Hi, negative thinking. I've been thinking that since long that patients who visit us for negative thinking, they say that whenever I want to feel it, whenever I'm just thought or a thinking, it's always coming in negative, that something will happen to me, my family, This we have been seeing from long time. And every patient's definition of their negative thinking is different. But what is negative thinking? If there is something which is called as negative thinking, the thinking which you feel make it negative. It is all happens in the mind. And we always say it's all in the mind. So I think that's right to say that. Normally we use the term positive thinking, and I always pressurize, or I always put my effort towards thinking positive, because if you have a process of having a thinking positive approach, which most of us don't do normally, but if you have a thinking positive approach, the negative thinking can be tackled. For example, when you are in a positive thinking, you say that all things going to happen in a positive way. But when you are in the process of an approach towards a thinking positive fashion, you will always say that even if it is go wrong, I will be able to handle it, or I will be able to tackle it. So I feel that once you are, or normally that the normal nomenclature saying that if I am able to manage my thinking, or if I am having a thinking positive attitude, I will be able to manage the negative thinking. And that this negative thinking can make me what I want to be. Because if I don't have a thinking which is negative, it's always good to have negative thinking, but it's not that you lead your life with negative thinking. So you always have something approach or attitude towards thinking positive. And thinking positive is something which can take you to a long distance. And negative thinking, a lot of people have this feeling that something is going to happen wrong, and this is if I do this way, if I go that way, if I go on the road, something will happen. It's all cooked in the mind. So once you have a peaceful mind, how you can have a peaceful mind? A lot of people nowadays are struggling to read books. The moment they read for 2 minutes, they feel asleep or they feel disturbed. If you are able to read the books, you will be happily reading it, and once you make it a habit, like 15 minutes reading, and then slowly increase the time, you will end up reading a book per day, or one book for 2 days. It depends on how you want to tackle it. For example, morning walk. If you do this morning walk and then walk the talk, and if you do this, you will be able to manage your thinking, negative thinking as well with that. Because you are getting up in the morning, which is also there in your mindset that I will not be able to get up in the morning. But when you are getting up and when you are going for a walk, you will be much more happy and much more conducive towards your own nature, attitude. Once you are able to do the change and you are able to make that difference in your own mindset, that I am going to change my mindset, I am going to be more positive, or I will be thinking positive thinking or thinking positive. I vote for thinking positive, because I have seen once you have an idea that I am going to tackle if the situation goes this way or that way, I know how to challenge it and I know how to overcome it. So if people comes to the negative thinking, the positive approach is much better approach compared to positive thinking. So like that, if we understand the beauty of thinking positive, the negativity or negative thinking can be transformed in such a way that when you are planning something and something goes wrong, so you know that if this is plan A is not working, I can switch off very well to such plan B, and then B is not working, I can very well switch off to plan C. This is how you can overcome your negative thinking. And in day-to-day life, you can do a lot of stuff like this. And if you visit a psychologist or a professional, a mental health professional, it is not the bad that if you go and visit, they will brand you as having some issues. Normally, I don't diagnose a patient. I have been working since long time, but I don't diagnose a patient. That means I am not writing a diagnosis saying that you are a negative person, or you are so-and-so person, or you are so-and-so problems you have, so-and-so disorders you have, so-and-so syndromes you have. It will help you to understand why I have a negative thinking, why I can get out of this negative thinking, and how I can get out of this negative thinking. Because these things can happen to anyone and everyone. Every day we do a lot of things in our life. Negative thinking, for example, while going on the road, I can get met with an accident, but it's not natural every time. For example, a lot of people say that this bus, last time we heard in the news that this bus fall in that avalanche or met with an accident. Not every time, the train or anything. Every time it's not going to happen, but the fear of that something is going to happen, or having a negative mindset in our own thinking, that can disturb us. But if you approach taking as a thinking positive pattern or attitude of that side, you can actually change your quality of life, and you can change your mindset, and you can be the person of your choice, and you can be the what you want to be, overcoming your negative thinking. Thank you.